Hello, everyone, and thank you for joining us today. My name is Catherine Libby. I'm the Program Manager for the Virginia Oral Health Coalition, an organization that works to integrate oral health into all aspects of healthcare and to ultimately ensure that all individuals have access to oral health care services. As child care professionals, not only do you all play such an important role in helping build the foundation for healthy behaviors and lifestyles, but you see firsthand, some of the challenges individuals experience with their oral health care and accessing that dental care that they need. Our goal today is to share information about early childhood oral health and the dental care resources in Virginia that are available to the children and the families that you serve. Our hope is that after participating in this course, you will better be able to understand the connection between oral health and overall health for young children and the importance of early and timely dental care. Our hope is also that you'll recognize early childhood dental decay and feel comfortable with the risk factors associated with early childhood caries and be able to ultimately communicate what resources exist to find early dental care for children and the families that you serve and where you guys can access additional training and classroom activities around oral health. To achieve these course objectives, we have two presenters with me today, Susan Farr from the Virginia Department of Health and Jackie Wake from the Smiles for Children program. Just a few reminders. We will hold Q&A to the end. A recording of the webinar will be archived and available to you following the ending of this webinar on the DentaQuest website. We'll have a course evaluation, and that's about it. So, without further ado, I will hand it over to Susan Farr, who will be giving her presentation on early childhood oral health. Susan?
Thank you, Catherine, and good afternoon. I would also like to thank everyone for taking the time to attend this webinar. I am the Maternal and Early Child Oral Health Coordinator for the Dental Health Program with the Virginia Department of Health, and I've had the pleasure of presenting to many health and early child professionals across the state, meeting many of you in person, and we are happy to also be able to broaden the exposure to these trainings by providing this webinar. We can't stress enough the importance of our partnership with you as non-dental personnel. Most of you interact with this population of children and or parents on a daily basis, and we appreciate your interest in how you can make a difference with the prevention of tooth decay. Here is my contact information, so if there's anything else that I can help you with following this training, please don't hesitate to contact me. It's important to understand why the issue of oral health for the youngest of our children is so crucial. First and foremost, unfortunately, tooth decay rates have increased in the 2 to 5-year-olds, and that's based on data from the National Health and Nutrition Examination Survey. This increase served as kind of a wake-up call to many of us because decay rates had been steadily decreasing since the 1950s, and the 2 to 5-year-old demographic was the only population group to experience an increase. Addressing oral health is also important because tooth decay is the most common chronic childhood disease. It is 5 to 7 times more prevalent than asthma and hay fever. It is chronic in that we cannot cure the disease with antibiotics or even by providing restorative dental treatment. And as in other chronic diseases such as diabetes or heart disease, risk factors have to be controlled on a daily basis in order for the disease to remain under control. We will talk about the risk factors on a later slide. Another reason to talk about dental health is that the number one health issue expressed by Head Start staff and parents, and that's nationwide, is oral health and access to needed services. Unfortunately, children who are at the highest risk for getting cavities are the ones who are the least likely to be able to receive timely dental care for many reasons. The good news is that tooth decay is very preventable. We all know that children must be healthy in order to learn. Children who experience dental pain, though, and the premature loss of baby teeth are often not able to grow and learn like their peers and can suffer from failure to thrive issues. Poor oral health is associated with poor school performance and social development. As teachers and early child staff, you may notice the effects of the pain in these children, anxiety, fatigue, irritability, depression, or withdrawal from normal activities, but you may not recognize these signs as symptoms of untreated cavities. When the cavities are deep enough to cause pain, the child is less likely to be able to sleep at night and focus in school. As you can see in this picture, with the loss of the front teeth, this child would have issues with eating and with speech development. And any resulting pain would affect learning and behavior in the classroom setting. I know that many of us have encountered people who may not value or understand the importance of the baby teeth. Baby teeth are important for chewing, as we have already mentioned. Without the baby molars to chew certain foods, nutritional needs are affected. Young children who are learning how to talk but who have lost their front teeth will have speech development delay issues. Also, each baby tooth saves a space for a permanent tooth. When the baby teeth are lost prematurely, those spaces can start to close up and can result in the crowding of the permanent teeth once they begin to erupt. Socialization and self-esteem can be affected by pain. Very young children may act out their pain instead of verbalize it. And most importantly, the research shows that the biggest predictor of tooth decay in the permanent teeth is prior decay in the baby teeth. That fact alone underscores the importance of the baby teeth and the importance of getting that message across to parents. Early childhood caries is what we formerly referred to as baby bottle tooth decay or nursing caries. It is the disease process that causes cavities in children under the age of 6. When children under age 3 suffer from cavities, it is considered to be severe early childhood caries. That name better reflects the rampant, very destructive nature of the disease. In the primary teeth, the decay process can progress through the tooth and through the mouth very rapidly. The enamel on baby teeth is much thinner than the enamel on our permanent teeth. The enamel can be extremely protective of the disease process with appropriate amounts of fluoride. But since it is thinner on the baby teeth, there is less protection, and the progression of cavity formation is rapid. Again, this is a preventable disease, and that is the good news, and that's also where you come in. As in other diseases, we can make predictions of risk for developing cavities based on both population and individual risk factors. Children from low-income families or certain ethnic backgrounds and those with special health care needs are automatically considered to be at an increased risk for developing tooth decay. There are also individual risk factors to consider as well. Those are the factors that exist in the lifestyle or the environment of that particular child that contribute to the chances of the disease, such as past history of cavities in that child, poor oral health of the parent, inadequate access to timely dental care, inadequate exposure to fluoride, poor daily oral care, and a high sugar diet. In order to understand how to prevent cavities and how these risk factors come into play, it's necessary to know the factors that are involved in the formation of the actual cavity. There are 3 main factors that lead to the development of cavities: dietary sugar and carbohydrates, bacteria on the tooth surface which help form a layer of plaque, and insufficient levels of exposure to fluoride. And we are going to go into each of these in detail. We've known for years that babies are not born with the particular mouth germ that causes tooth decay. The name of the main causative germ is Streptococcus mutans, and it is usually spread from mother's mouth to baby's mouth sometime during the first 2 years of life. Most of us have the strep mutans germ in our mouths, but in varying levels of quantity and quality. The germs are spread from mouth to mouth by different saliva sharing behaviors such as the ones listed here. Sharing of feeding utensils, and that's often when the mother is testing the temperature of a food. Kissing the baby on the mouth. None of us like to see this one, but the quote-unquote cleaning of the pacifier in the parent's mouth after it falls on the floor. The pre-chewing of food, which is mostly a cultural-based practice, and the sharing of a toothbrush. And then this picture on the slide also illustrates a behavior of the baby's fingers being in mom's mouth, and then we know that those baby fingers will end up in baby's mouth. So some of these behaviors are very well intentioned, but they could end up putting the baby at risk for future tooth decay. The point to get across to parents is that since this is an infectious disease process, the passing of germs from one person to another is very important for parents to take good care of their mouths in order to reduce the chance of disease in their child's mouth. Bacteria need a food source to survive and thrive, and that food source for this particular bacteria is sugar. Typically, when we think of sugary foods, we think of cookies, candy, Kool-Aid, sodas. The fact is that it is difficult, if not impossible, to avoid all sugar sources in our daily diet. Even natural sugars that are found in milk, juice, or fruit, and the complex carbohydrates in breads and crackers can also contribute to decay in some cases because these starches will start to break down to the simple sugar level in the mouth. So the idea is to limit both the amount and the frequency of sugar intake in order to reduce the chance of tooth decay. Parents usually give their children juice throughout the day. They frequently give their children juice throughout the day thinking that it is healthy, especially if it's the 100% fruit juice. However, these juice drinks, even if it's labeled as a natural juice, they have sugar, and consuming them frequently over a period of time can lead to cavities. So once you start reading the food labels and looking for the sugar content, remember that 4 grams of sugar on the label is equivalent to 1 teaspoon of sugar. So we've talked about the bacteria and the sugar as kind of the bad guys in this equation. So here's the good guy. We're going to talk about fluoride. The widespread use of fluoride over the past several decades has been the major factor in the decline of tooth decay rates in the United States. Fluoride is found naturally in groundwater and is both safe and very effective in the prevention of dental caries. It is also added to community water sources and to other products for the purpose of decreasing the risk of tooth decay in children and adults. In order to optimize the preventive action of fluoride, we need 2 sources, systemic and topical. Systemic fluoride is fluoride that is ingested, and it's important both during tooth formation and after tooth eruption. Most Virginians have access to systemic fluoride through their community fluoridated water systems. Well water may or may not have enough fluoride to prevent tooth decay, and the same is true for bottled water. If the main water source for the family is found to be deficient in fluoride, fluoride vitamins can be prescribed by the physician or the dentist for children who are considered to be at high risk for developing cavities. And the only way to know how much fluoride is in the water and whether or not it is deficient is through water testing. Once the teeth have erupted, adults and children need several sources of topical fluoride, such as small, low doses on a daily basis, like from toothpaste, fluoride rinses for children over age 6, and fluoridated water. And also professionally applied higher dose sources, such as fluoride varnish, which can be applied by a dental or a medical provider every 3 to 6 months, depending on the individual risk of the child. This slide describes how a cavity actually forms, whether it's on a baby tooth or a permanent tooth. The bacteria that causes cavities is constantly reforming and growing in a layer of plaque on the teeth. So when we eat foods that contain sugar, the bacteria uses that sugar as a food source and produces an acid that eventually weakens and destroys the enamel on our teeth. The more frequently we eat those sugary foods, the more frequent the acid exposure is. Frequent acid exposures throughout the day, every day, can lead to the formation of an actual cavity. These pictures illustrate the progression of the disease process. The initial weakening of the enamel, which we call demineralization, is illustrated in the upper left picture and shows up as a chalky white area at the gum line area of the tooth, usually in a crescent shape like you see there in that picture. And then as the enamel continues to break down, discoloration and destruction of the enamel and the other portions of the tooth will occur. This picture shows the distinct difference between the initial stages of the weakened enamel, the demineralized enamel, as illustrated by the white line that you see at the gum line, and then the complete destruction of the enamel that you see in the cavity, in that cuspid tooth. Timely and early intervention, such as topical fluoride application, is extremely effective in those initial white spot demineralization stages of the enamel. The tooth on the right has a cavity, and so that needs to be treated by a dentist by placing a filling in that tooth. Now we'll discuss how you can use this oral health information. We have a broad audience today, so not all of these suggestions will apply to everyone, but our hope is that you can implement at least one of these steps that will strengthen preventive efforts in your particular setting. So we'll discuss educational messages to be given to parents, oral screenings that can be done by non-dental providers such as yourselves, toothbrushing in the classroom, and then give you some other classroom resources and training resources. It's helpful to keep in mind these protective factors that help prevent disease as we go through this next section. Preventing decay involves these 4 things: maintaining overall low levels of sugar in the diet, maintaining good daily oral hygiene to keep bacteria levels to a minimum, getting adequate levels of fluoride sources, both systemic and topical, and accessing timely professional dental services. We know that sugar is a main contributing factor for the formation of cavities. The American Dental Association recommends eating nutritious and balanced meals and limiting snacks, especially sugary snacks, between meals. Most of the foods that we consider quote-unquote good for us are the ones that we have listed here as the healthy foods for teeth, and these are hopefully familiar to all of you. The obvious food selections that are unhealthy on the right column for children's teeth are any of the foods that are high in sugar, such as candy, cookies, and the other ones listed. Also be aware, again, as I mentioned before, that on the food labels, as you're reading them, that 4 grams of sugar, again, equals 1 teaspoon of sugar. So once you start looking at these labels and doing the math, I think the sugar content of certain foods will surprise you. Daycare centers can set an excellent example by offering healthy foods and snacks on a regular basis and then limiting the sugary foods to special occasions. The next protective factor to discuss is good daily oral hygiene care to reduce the bacteria levels on the tooth surface. I will discuss these for specific age groups, starting with infants on this slide. This information is important to give to parents. It's also useful if you adopt a toothbrushing policy for daycare centers, which we'll also talk about in a little bit. Even prior to actual tooth eruption, it is recommended that the baby's gums be wiped with a clean, soft washcloth. This helps to establish a daily routine for the mother and the baby so that as the baby teeth first start to erupt at around age 6 to 7 months, the habit is already established and the parent can continue to use the washcloth to wipe the baby's teeth. As more teeth begin to erupt, then the transition can be made from using that washcloth to a very soft, gentle baby toothbrush. It is especially important to clean the baby's teeth following the very last feeding of the day before bedtime to rid the mouth of any residual milk and bacteria. As more teeth begin to erupt and the child's motor skills develop, brushing becomes a shared activity between the child and the parent. So for toddlers, the teeth should be brushed at least twice each day, and the toothpaste information is on the next slide. The parent can begin to demonstrate brushing the teeth and spitting out the toothpaste once the child is able to stand at the sink to brush. It's important for the child to actually see the parents brushing their teeth as well. Toddlers can be encouraged to brush their own teeth, however, they will mostly chew on the toothbrush, and that's fine for now. If toothpaste is used, just a rice grain size is necessary, regardless of what toothpaste they use. Preschoolers should also be brushing at least twice a day, and by this time their motor skills are developed enough that they are doing a little bit more brushing than chewing. But it's still very important that the parent supervises the brushing, helps with the brushing, and puts the appropriate amount of toothpaste on the brush, which now can be kind of a small pea-size amount. Up until recently, the toothpaste recommendations vary depending on the individual child and what risk factors, if any, exist for that child. Children who were considered to be at low risk for developing cavities could use a non-fluoride toothpaste until they could learn how to spit out, which will be at about age 2 or 3 years of age. And that's on the top of the slide to the left. And then children who were at moderate or high risk for developing cavities might be advised by the dentist to use a very small amount of fluoride toothpaste from the time the teeth erupt. Research shows that these very low doses of daily fluoride are extremely effective in preventing decay, and there is no risk from swallowing this very small amount. However, this information was confusing as a public health message, so the American Dental Association reviewed the evidence and issued a recommendation that I've put in a box at the bottom of the slide. That recommendation came out just this year, and it's a more unified, hopefully less confusing recommendation stating that all parents should brush their children's baby teeth with a rice grain amount of fluoride toothpaste as soon as the teeth erupt, and that's a recommendation regardless of what their risk category might be. So that's kind of an across-the-board recommendation. But the ADA also states that it's critical for dentists to provide individual counseling to the parent. So parents should follow the advice of their child's dentist regarding toothpaste use. Professional dental visits should begin no later than the first birthday. This recommendation is endorsed by the American Academy of Pediatrics, the American Association of Pediatric Dentistry, the American Dental Association, as well as other major health organizations. Many dentists are not comfortable seeing children this young, however, so it may take some searching by the parent to follow up on this recommendation. However, we still want to make sure that parents know the importance of this early dental visit and the purpose of the visit, which is to identify any risk factors for tooth decay that may exist for that baby, to educate the parent based on those risk factors, and then determine the frequency of future visits also based on those risk factors. This picture on the slide illustrates the ideal positioning for the age 1 dental visit. It's what we refer to as the knee-to-knee position, with the baby situated on the laps of the dentist and the mother. And I think it's important that parents understand the purpose of this visit and what it will look like, and that it's not to sit that little 1-year-old baby in that big, scary dental chair. In addition to educating parents with oral health messages, oral screenings can be done by non-dental personnel. In the absence of a dental home and or the age 1 dental visit, oral screenings by non-dental providers, including early child professionals such as yourselves, are becoming more and more common. And based on Virginia's competencies for early child professionals' health, safety, and nutrition practices, this is considered a best practice in the absence of a dental home for the child. The dental health program offers trainings for child care centers who are interested in providing periodic oral screenings on their children. This website link on the slide gives you a good visual demonstration in the meantime for what this would look like. Just knowing this positioning that you see here on the slide could come in handy one day if the parent has no one to take their child to, and there is a reason to actually look into the child's mouth as kind of a triaging mechanism to help the parent. The parent holds the baby facing her and holds the baby's hands while the baby's head is leaned back on your lap. And then the baby is in a good position for you to get just a quick look inside the mouth. It's very simple and it's very quick. These next slides will show a few examples of what you might find in the child's mouth during a simple oral screening that can be easily reported to the child's parent and hopefully result in the parent taking the child to the dentist for a comprehensive exam if that hasn't happened yet. These two pictures, again, illustrate the white spots that indicate the earliest stage of tooth decay development, as well as a full-blown cavity. This picture shows a cavity in one of the baby molars that might be easily missed by a parent, but using a flashlight and the correct positioning of the child, this is something that you could easily spot in a simple screening procedure. These teeth are obviously completely destroyed by the decay process. However, unless someone actually lifts the lip, which is a very important part of doing the screening, then these abscesses, this infection might remain undetected and then untreated, resulting in a potentially very serious systemic infection. Toothbrushing in the classroom setting is another valuable preventive activity that is also considered to be a best practice, and it is fairly simple to implement. It can be done either by sending children to the sink, often 2 by 2, or at the table as a group activity. Either way, the basic supplies for this activity are listed on this slide. A labeled toothbrush for each child or a washcloth for infants, toothpaste, gloves for the teacher to wear, and then a small paper cup and a paper towel or a napkin for the child. The group brushing is described here, and this is actually used in all the Head Start classroom settings because Head Start is required to do daily toothbrushing for their children. Each child is given a paper cup and a napkin at the table, and the teacher then dispenses the proper amount of toothpaste on the rim of that cup, and so one tube can be used for all the children since it is not actually touching the toothbrushes. The child then dips his brush into the toothpaste that's on the rim of his cup and starts to brush. And brushing time should be at least 1 minute and preferably as long as 2 minutes. The child then spits out the toothpaste into the cup several times, wipes the mouth with the napkin, and then pushes the napkin down into the cup. The brush is then rinsed, but the mouth is not rinsed. And what that does is allow the residual toothpaste and fluoride in the toothpaste to remain in the mouth, and that adds more preventive benefits to the brushing. The CDC has specific guidelines on toothbrush storage for classroom settings, which are very helpful, and they can be found on the CDC website. They recommend that toothbrushes be stored in an open container that allows them to stand upright and out of contact with other children's brushes. Each brush should be labeled with the child's name, and the brush head should be positioned up and the handle down. Here is a list of some of the curriculum resources that are available online. These are great resources for all early child settings for talking to parents or to children about the importance of good oral health for young children. I just advise you to please pay attention and follow their use guidelines and copyright guidelines. As Catherine said earlier, this training will be archived for people to access, but here is a list of 3 other excellent training sources that can be accessed online. The Smiles for Life curriculum is a lifespan curriculum, and it includes 2 modules on childhood oral health issues, and then the other 2 trainings are very specific to children oral health issues. This slide just summarizes some of the key points for this part of the presentation. Hopefully you have a better understanding of why primary teeth are so important for the overall health and well-being of our young children. The key behaviors that contribute to preventing tooth decay are brushing to control the bacteria, eating a healthy diet, getting the right amount of fluoride to help strengthen the teeth. And it's important that parents practice good oral hygiene to reduce the passing of germs to the child. Easy screenings can be done by parents and early child staff on a regular basis, and that is considered a best practice. And babies should have their first dental visit by their first birthday, and then regular visits from there on out. And with that, I'm going to turn this over to Jackie Wake from DentaQuest.
Thank you, Susan. Like Susan said, this is Jackie Wake, and I'm the State Outreach Coordinator for the Smiles for Children program. And here is my contact information if you should need to reach me. Smiles for Children is Virginia's Medicaid and Famous Dental program. So once a child or an adult is signed up for Medicaid, they're automatically enrolled in the Smiles for Children program. For members that are under age 21, we provide coverage for regular dental checkups every 6 months, x-rays and cleanings, braces if necessary, extractions or crowns, or anything really that the child needs for their dental health. For members who are over age 21, Smiles for Children does not cover services except for medically necessary oral surgery, and it has to be done by a participating dentist. Other services that are covered by the Smiles for Children program are transportation. So if transportation is not available to the child and their family, they may call their MCO or their health plan to set up transportation for their dental appointment. And we also cover translation services. In order to set up translation services or find a dentist in the area that provides translation services, the member can call 888-912-3456 and talk to member services. In order to actually locate a dentist that takes the Smiles for Children program, you can visit the DentaQuest website at www.dentaquest.com. And then it's a really simple process. You go under Members and Virginia, type in your zip code, and you can locate a dentist in any area of the state. You can call 888-912-3456 and also let them know that you're working with a member of the Smiles for Children program and need help finding a dentist that will work with them. Or we also have a DentaQuest mobile phone app. And so if you have a smartphone, you can download that app and locate a dentist that way. If you've already seen a dentist that participates in the Smiles for Children program and have a complaint, the member or the caregiver can call that same number and provide details about the problem. And we'll further look into that complaint. Some other resources that are available in the state of Virginia, other than the Smiles for Children program, is the Virginia Dental Association Foundation and the Virginia Healthcare Foundation. The Virginia Dental Association Foundation offers a number of resources for oral health. The Mission of Mercy program, which are dental clinics that provide free dental care to those who have limited access. Looks like the next ones that are coming up are the Special Olympics Mission of Mercy, the WISE Mission of Mercy, and the Grundy Mission of Mercy. For more information on the Mission of Mercy, you can contact the VDAF, and their phone number is 804-620-4032. The Virginia Dental Association Foundation also offers Give Kids a Smile Day. That is through the American Dental Association, but kind of run in the state of Virginia by the Virginia Dental Association Foundation. This takes place annually in February with the goal to increase children's access to dental care. And there are sessions across the state of the Give Kids a Smile Day. They also provide services through the Donated Dental Services Program. This program provides comprehensive dental care through a network of volunteer dentists and specialists for individuals who are 62 years of age or older or have some type of disability. And they also have to live in Virginia. And again, if you want to reach them, you can call 804-620-4032 or visit their website at www.vdaf.org. And finally, the Virginia Healthcare Foundation offers information on services that are available through sliding scales or free clinics. And their website is www.vhcf.org. And you can reach out to Tracy, and her email address and phone number is listed on this slide. I want to thank you for participating in our webinar today. This presentation will be posted on the DentaQuest website under the state of Virginia. Please contact us for any questions you may have, and we look forward to continuing to provide oral health information and resources. Thank you.
The chairperson has left the conference.